So what, for God's sake, is the right dose of finasteride? We all know that the manufacturer recommended FDA approved regulation dose, which is also found in the package insert, is 1 milligram a day in persons above the age of 18. So when we speak of microdosing, can we get away with a zero point 0.2 milligram a day dose? A dose which will give good results as far as the maintenance of hair is concerned, and at the same time minimize the risks even in those who are vulnerable? Is a 5 times lesser dose even worth the consideration? Or is it, just like some people say, a placebo effect of finasteride to prevent the nocebo effect of finasteride? Or is it just to pander to the worst fears of the patient who has fenestrophobia or finasteride hesitancy, just so in case he signs up fast for a hair transplant? Since patients think about taking finasteride very late in their hair loss timeline, are we not wasting precious time? Is your doctor not playing the proverbial fiddle as he sees Rome burn? Let's find out. You give me a job and I'll give you a study. Does medical research, which happens without proper disclosure, without the medical scientist, the researcher, revealing his employment details, hold any water? Commerce today plays a big role in the information and the data that we are fed. Complete election, even in powerful nations, is sought to be derailed by a barrage of misinformation today. You would be completely naive and gullible to think that the hair loss industry would be immune to such commercial influences, especially when the hair loss industry has such high stakes for commercial players, being a $2 billion industry. I just give a simple example which is very relevant to the times we live in during the pandemic. The AstraZeneca vaccine was so much in the news last week when it was reported that it has been banned till further investigation in some countries in Europe because there were reports of 37 patients who had suffered blood clots out of a total of 17 million patients in the European Union and UK who were administered this vaccine. But with a fair mind and in the proper perspective, if you dig further and do some research, you will find that the prevalence of blood clots in the normal healthy population is much, much higher, which is 1 in 1,000 of the population. The report of this rare side effect may be just a statistic, but look at the way it has helped fear-mongers and rival companies. This vaccine hesitancy due to misleading information is the same as finasteride hesitancy and finasteride phobia. People start believing and feeling even the remotest side effect when the mind gets primed by false information and it then decides to go into an overdrive. Similarly, we need to see the bad press about finasteride in a holistic manner. We all know there are huge stakes in the hair loss industry. A medicine which is a fraction of the cost of other alternative treatments, so-called alternative treatments like snake oils, etc., will never be allowed its full potential of growth by its competitors, especially when they know it's a miracle drug. When side effects are so rare, but we find ourselves comparing finasteride with even laser comb, which neither has an effect nor a side effect. So coming back to microdosing, it has been shown by a recent study that the effect of taking 0.2 milligram finasteride every day or taking 0.5 milligram 3 times in a week is almost the same as taking 1 milligram tablet once a day. You may support these findings through endless studies and research, and theoretically this may even be possible. But the body does not behave in a similar manner in all cases. In my patients, I very commonly use 0.5 milligram on alternate days. But this dosage regime has not proved to be beneficial in the vast majority of the patients. I use this dose merely in those patients who are fearful of finasteride. I use this dose to allay their anxiety and have him as an ally while I try and convince him that side effects are not so common as he thinks them to be. And gradually he overcomes his fears and his anxiety is allayed. And then, when he has more trust in the doctor and more trust in the medication he's being prescribed by the doctor, he agrees to upscale the dosage gradually over a period of time, and he finds that he has no ill effect and continues that medication for a longer period of time. So, in the patient's interest, knowing fully well that 0.5 milligram on alternate days is not a very beneficial dosage regime, I have been using this drug in those who are fearful of taking finasteride. To me, my clinical judgment and instinct born out of years of practice, years of treating hair loss and doing hair transplants and administering varying doses to varying patient populations is more important to me than one odd research paper which keeps coming up every now and then. So I do not think that 0.2 milligram of finasteride given daily or 0.5 milligram finasteride on alternate days is an option in patients who are thinning, in patients especially who are young and having aggressive extensive baldness. This approach merely is wasting time. The patient who has agreed to take finasteride has come to you very late in the timeline of hair loss after trying so many other options which are available on the internet. And if we start him on a low dose of finasteride, I feel that we are doing gross injustice to the patient because precious time is being lost. And we all know that when the hair shaft diameter thins out so much that it reaches below the threshold level of 50%, finasteride will fail to act. Finasteride will not regrow this hair to full bloom. It just reminds us of Nero and how he played the fiddle as he watched Rome burn. As per the dose response bell curve of finasteride, most patients benefit with the dose of 0.8 milligram, which can be considered as the sweet spot. There are certain outliers who benefit by 0.5 milligrams a day, and there are others who benefit by 1 milligram a day. But most patients benefit by 0.8 milligram. Any dose above 0.8 milligram will not benefit a large majority of the patients. After 0.8 milligram, not much benefit accrues by increasing the dose further. There is a dead end that we reach, after which there is no benefit by increasing the dose of finasteride. So this is the rationale of my customized dosing, a belief born out of years of clinical experience that there is no one dose that fits everybody. All patients are different, their mindsets are different, they are different psychologically, their metabolism is different, and therefore one dose will not suit them. As a doctor, we are duty bound to seek out the lowest dose that will benefit the patient and at the same time save him from the likelihood of adverse reactions. So my approach in administering finasteride to the patient with hair loss and after hair transplant can be divided into two categories. One is for merely hair loss and the other one is after hair transplant. Firstly, for hair loss, I start the patient on 1 milligram finasteride on alternate days if he is mentally robust and believes in the efficacy of finasteride. And this only after evaluating him physically, psychologically, and sexually. I will then customize the dose by upscaling and rarely by downscaling. If the effect of finasteride after a few years of regular intake starts to wane, I may exhibit the patient with 0.5 milligram dutasteride taken once a week in place of finasteride for that day. I also insist that every quarter he should stop finasteride and stop finasteride for a fortnight. That is 15 days after every 3 months to flush out the built up levels of finasteride in the tissues. Secondly, for a patient who has had a hair transplant, I would expose the patient to 1 milligram a day finasteride, and this I have already discussed with him before the hair transplant. There are very minuscule patients in which I do not expose them to finasteride. A lesser dose of finasteride, microdosing of finasteride will never help after hair transplant because time is of the essence. We cannot customize the dose of finasteride after hair transplant because there is a very narrow limit of time span within the timeline of growth of grafts after hair transplant. And we cannot let DHT have full play over the grafts as they are growing. And we want to reduce the margin of error by not customizing the dose after hair transplant. So after a hair transplant, the full dose, 1 milligram a day of finasteride, the regulation dose, the dose which is recommended by the FDA, is to be given for 6 months. There is no compromise in this dosage after a hair transplant because we have counseled the patient properly, and many times the patient has undergone a trial of finasteride before a hair transplant. So there is no compromise on this dosage after a hair transplant because we want to give the patient the most optimal result after a hair transplant and not let one variable play havoc with his grafts. I don't wish to play fiddle as I watch him burn. So in my regime, microdosing is not an option, especially for those whose baldness is not yet stable, and especially for those who are young and have visible signs of extensive baldness. This microdosing may serve as an expedient commercial purpose, but it has no role to play in the benefit of the hair loss sufferer, and especially after a hair transplant. So customized dosing of finasteride is what I practice and propagate. So for those who want to know more about finasteride, its mechanism of action, its many benefits, and the dosages that are best suited, and how to arrive at these dosages, please refer to the link in the description box below. And as always, I'll be very happy to reply to your comments. Thank you for watching this video and God bless you.